Hey guys, today I want to talk to you about shoulder bursitis. This is a really common injury, one that I see a lot with CrossFitters, weightlifters, and people who just love going to the gym. So in this video, what I want to do is cover what shoulder bursitis actually is, what symptoms you may be experiencing to indicate that you have shoulder bursitis, the common risk factors that you might have that would lead to shoulder bursitis, how you can go about fixing shoulder bursitis yourself, and if your shoulder bursitis is so bad and you can't fix it yourself, who to see and what to ask for and look for to get it fixed by a therapist or a doctor or someone you pay to give you an extra hand. So first of all, what is shoulder bursitis? Okay, so first of all, we got to think about what the bursa is. Now the bursa is a little cushion that's, all through the body we've got different bursa, but specifically for the shoulder, it's under this bone here, the acromion. So a little cushion in there. Now its job is to protect the joint as well as part of the rotator cuff called the supraspinatus. So day to day, as you sort of move your arm around, what happens is the space under that bone will change and it actually narrows, especially more in that overhead and pushing positions. So as it narrows, the cushion will sort of get squished and protect the rotator cuff and the tendon in there from, inflaming and tearing. Now the issue is sometimes our shoulder doesn't move perfectly. So if you're a little bit internally rotated, as you put the arm through those ranges of motion, it actually decreases that space further than what it's supposed to be. And what happens then is every time you move through that range, it really irritates the bursa and the rotator cuff. And eventually, over time, with that micro trauma again and again and again, we get inflammation of the bursa. So bursa and itis, inflammation of, so you have bursitis. So what are the risk factors that can lead you to get bursitis? The main one is shoulder internal rotation. And like I mentioned, when it's internally rotated, that space where the bursa sits is actually narrowed. The second major factor which can lead to bursitis is poor thoracic mobility. Now, when I talk about that, I'm talking about the thoracic part of the spine, the area that's sort of between your shoulder blades. Now, if you work at a desk or you play too much PlayStation or you sit on the couch a lot, you kind of develop that little bit of a hunch, and that locks you in sort of thoracic flexion. Now, when you're locked like that, the shoulder will follow that sort of position and again, decrease that space in there. So we'll have to look at extending that spine and opening that up, but we'll talk about that in a moment. The third risk factor is poor shoulder stability. Now, what does that mean? So shoulder stability is how the four rotator cuff muscles work in sync with each other to balance the shoulder and the arm as you work it overhead or you're pushing forward, things like that. Now this can come about again from poor shoulder mechanics with that internally rotated position or previous injuries. So the symptoms you might be experiencing with shoulder bursitis is a real deep, dull ache around that shoulder. Most commonly, I'll see it when people are pressing, so things like bench press, incline dumbbell press, flies, especially when they're on a machine, like a machine fly, because you're locked in one plane of motion. Your shoulder can't find that sweet spot and get around the pain. Or in overhead pressing, like a barbell press, seated military press. Another really common one is just like a dead hang from the bar. So your shoulder is locked in that overhead position. If that's internally rotated, it's going to crush that bursa and really inflame it. So if you're experiencing these symptoms and you think you might have shoulder bursitis, well, what are you going to do about it? It's limiting your ability to train consistently at the gym and get those gains that you're after. So it's actually pretty simple. Like I said, we know what the risk factors are, so we know what needs to be corrected. That's that shoulder internal rotation, the thoracic mobility, as well as rotator cuff control and stability through there. So now that we know what the risk factors are which would lead to shoulder bursitis, we know what things need to be targeted to correct shoulder bursitis. Take the pressure off the bursa, stop it inflaming, and allow it to actually heal. So the first thing we need to correct is shoulder internal rotation. Now there's multiple muscles that will be internal rotators of the shoulder, However, there are two major ones that you can easily work on at home or at the gym to try to correct that position and get it sort of stopped hunching forward like that. So those two main muscles, we've got the pecs and the lats. So the first thing I want you to start doing is stretching those pec muscles. Now this isn't too hard. All you have to do is find a doorway or say a squat rack. You're going to put your arm up in the position that I've shown here. You're going to have the elbow ideally a little bit higher than your shoulder height, and you're going to sort of lean into it like this. Now what you should feel is a stretch so in the upper outer quadrant of your pec muscle, not in the top of the shoulder. If you're feeling it in the top of the shoulder, you're probably pinching that bursa, and then we're going to have to dial this stretch back a little bit. So to do that, you might want to decrease the height of the elbow. I know it's not in that optimal position, but it's better than nothing. And then just sort of gently find that sweet spot. So alter the arm position, find that until you find the stretch in the outer quadrant of the pec. Now when you do this, minimum 3 sets of 30 seconds on each side. You might only have the shoulder bursitis, let's say in your left shoulder, but changing the tone of the right will also work the nervous system to go, oh, this is the new normal, and it'll transfer that across both sides. The next muscle is the lats, the latissimus dorsi, all right? So there's two things I want you to do to try to correct this. First, you're going to stretch it just like we did with the pecs. Again, finding a doorway or a squat rack, something to grab onto. I want you to reach forward, thumb pointed down, hold onto that door frame, and then you're going to sit back while maintaining that grip on the door frame. And you're going to allow that shoulder to stretch forward. And that's going to open up all down the side through those ribs. And you might even feel it all the way down into the lower back because the lats goes, it's a huge muscle. It goes from the shoulder all the way down into the low back, the thoracolumbar fascia. Again, 30 seconds, 3 times, both sides. Now, once you've done those stretches, what you want to do is find a foam roller and roll up and down the side. So you'll place the arm just overhead, gently. You don't need to put it into that compromising position that pinches it, wherever it's comfortable. And then you're going to just pop it down, like lay on top of it. It's going to be pretty uncomfortable. And then you're going to roll back and forth. I'm going to say like maybe 15 passes on each side for this one. If it's really, really uncomfortable, you can start slower, or even sort of don't lean your entire body weight into it as you start to develop that tolerance. So now that we've addressed the major muscles pulling the shoulder into the wrong position, you're going to want to start to look at your thoracic mobility. Now, like I said, thoracic mobility is that locked, flexed over position of the mid-back. So we're going to want to correct that and sort of get you standing upright a little bit better through the spine and not having that hunch that you see some people who sit at a desk develop so much. So to start with, I want you to do what's called a simple yoga pose called the puppy dog pose. Now, it might look really simple, but again, this is actually going to stretch your lats out, but it's also going to target that mid-back that we need to hit. So you're going to pop down on your knees, reach the arms all the way forward like I'm showing here. But then once you're in this position, really drive the sternum down and forward, and you should feel like a grindy, pulling sort of sensation between the shoulder blades. That's when you know you've got it and you're mobilizing the mid-back. What I like to do is you do 10 deep breaths, and as you breathe out, you push further down. And you're sort of going in and out for those 10 breaths, and maybe on that last breath, you're going to hold it driving down for about 10 seconds. If in this position you experience that shoulder pain as you reach it up and over, don't put your arms so far forward. You can take them out to the side just to find that sweet spot. It just means you're going to get a little bit less lat stretch in this position. The next stretch that I want you to do for the thoracic spine is what I call just the bench dowel stretch. To do this, what you're going to do is get a broomstick, as I've got here, or anything that you've got similar, just as long as there's not too much weight in it. Then you're going to find a bench at the gym. You're going to pop your elbows just on the edge of the bench, and then have your knees so they're slightly behind the hips. Again, like the puppy dog pose, you're going to drop the chest through and really thinking about pushing the sternum to the ground. Don't just sink your tummy forward. So pushing that sternum down. As you drive the sternum down, bend your arms so that the dowel comes back towards over the top of your head. Now with this one, do whatever you feel feels right. You can hold it for 30 seconds, or you can do similar to what we did with the puppy dog pose, where you breathe in and out and getting a little bit more range of motion with each pass. The final one might be too difficult to start when you're in that really acute phase, but is a game changer when working on the thoracic mobility. Now this is called a wall angel. So to do a wall angel, what you're going to do is go up against a flat wall, have your feet flush against the wall, bum against the wall, back against the wall, and even your head against the wall. Then put the arms up in this position where you can see my elbows and wrists are touching, and you're going to reach them up over the head, sort of maintaining that contact with the wall. What you might find if you're really restricted in the mid-back is your low back is going to arch forward and kick you off the wall. Try to keep the ribs down and flat to maintain that position. Now, as you do that, what's going to happen instead is your hands are going to knock forward off the wall. That's okay. So you're just going to work with the range that you have. So if you can only reach up, say, 15 centimeters, that's all right. Go up and down in that range. And what you'll find as you do this more and more, you're going to start to develop more range as you mobilize through that mid-back. Again, for this one, we're looking at about 3 sets of 10 reps. Now, this one can be quite exhausting because you really have to work against the muscles sort of pulling you forward and really push that position. So you're going to really feel it in the mid-back, and you are probably going to want to rest between sets for this one. So now that we've addressed the position of the shoulder, the position of the spine, the next step is to improve the stability of the shoulder. The stability, like I said, can come about from old injuries or the positional dysfunction that you've got from it, or even just having bursitis for a really long time. Pain can inhibit the rotator cuff function. So the first exercise we're going to do is just your basic external rotation with a band. This works on your infraspinatus, your teres minor, and a little bit on your supraspinatus. These are huge players in stability. Now, it's a tried, true, and tested sort of exercise. It's quite dull and boring, but it does work. For this, what I recommend is for the first, say, week, just do this normal external rotation that I'm showing here. Once you're feeling comfortable with this, and you can start to get that hand overhead in your day-to-day activities, what you're going to do is external rotation, maintain that 90-degree bend at the elbow, and then push up overhead. So what I call this is an external rotation with punch up, then you're going to come back down, take it back in, and then go through that. So each punch up is 1 repetition. As per normal, we're going to go 3 sets of 10. Keep this nice and simple. On top of that, we also want to work sort of the mid-back. So we're just going to also add in some band pull-aparts for this one. It's going to work those same rotator cuff muscles, but it's also going to train the position of the shoulder blades to come back a little bit. Just grabbing each end of the band like I'm showing here and pulling apart. What I actually like to do is do 1 set where my thumbs point in. You're going to train more the rhomboids, and then 1 set where my thumbs turn out, and that's going to train what's called your middle traps. So that's the part of the traps that are between the shoulder blades. After this, we're actually going to give a little bit more resistance to the rotator cuff, is we're going to add in some kettlebells if you have access to it. So what I like to do is you get down on the ground, lying supine or face up. You're going to have a kettlebell. Let's just start with, say, 8 kilos for the guys, or maybe 4 kilos for the girls, and you can build up in resistance as you feel more confident. Have the kettlebell upside down like I'm showing here. Lock your elbow out so it's up above your shoulder, and then you're just going to turn that left and right. What you're going to feel is as you turn it, because the kettlebell is upside down, your body's going to have to sort of work out how to stabilize that, and that's that rotator cuff training. So going back and forth, 3 sets of 10 for this one. If you can get through all of that quite comfortably, then we're probably ready to do the next exercise as well. So I call this one the overhead kettlebell walk. To start with, maybe for the first few days, just pop the kettlebell overhead as I'm showing here and go for a straight walk, maybe about 10 meters. Once you're good with this, then you can add in walking in a zigzag back and forth, because each time you turn, you're going to create more stability for that shoulder. Okay, so we've gone through what you need to do to fix this shoulder. However, sometimes the bursitis, it's super bad. This hasn't fixed it. You've tried it for a couple of weeks. You're not seeing improvement. This is probably an indication that you need a little bit of medical help to get on top of this pain. Who do you see and what do you look for when looking for a therapist for this? Now we've got multiple options. Most people will go straight to the doctor or their GP. A GP's line of thinking will generally be less conservative management and more medical management. They're going to probably send you for an ultrasound just to make sure that that bursitis is present, and then they're going to follow that up with a cortisone injection. Now, a cortisone injection isn't a bad thing by any means and can be used in people's rehab plans. However, the issue with cortisone injections is if you go straight for that injection and you haven't put in the work to improve your mobility, improve your stability in that shoulder, the cortisone injection is only going to change the symptoms short term, but the dysfunction that led to it, that's still there. So it's probably going to come back in 2 or 3 months. So what I recommend doing before trialing a cortisone injection through your medical practitioner, maybe see a physiotherapist or a chiropractor or even a massage therapist who has a little bit more knowledge in hands-on therapy and changing the tone of those tissues. So me personally, I love therapists that do active release technique or ART. So what I do is I would go find someone who does this, get them to work on those pecs, those lats, and then because they can get stuck into a few more tissues than you, subscapularis, teres major, supraspinatus, infraspinatus, and the deltoid. If they can target all of those muscles, I guarantee that'll make a big difference for you. And for bonus points, if you really want to change that bursa, I'd also find someone who can do dry needling and is confident, and ask them that when you're booking, confident to get into that space under that bone there, the subacromial space it's called, and get some needles right at that bursa, because what that's going to do is increase the blood supply to the area and speed up the healing process to those tissues. Okay, so you've now got a whole ton of information and things to do to try to fix your shoulder bursitis. All right, now you have all the tools to look after your own shoulder bursitis and try to get on top of your pain. If you found this video helpful, I'd love you to subscribe to my video and give me a like, and even comment below and let me know how it's helped you or if it hasn't, and other tips you might like for this injury.